Comprehensive Medical Evidence Review. Hawks Case. Date: June 28, 2025. Subject: Summary of objective medical evidence, injury causation, and refutation of discrepant medical opinions regarding Mr. Hawk Starchild's post-traumatic injuries and clinical presentation. I. Introduction. This document provides a detailed summation of the medical evidence, the mechanism of injury, and the immediate clinical sequelae experienced by Mr. Hawk Starchild. It aims to meticulously compare these objective facts against medical reports from Dr. Baker and Dr. Bates, highlighting significant discrepancies and asserting the direct causal relationship between the traumatic incident of February 20th, 2025, and Mr. Starchild's profound and ongoing medical conditions, including complex regional pain syndrome, CRPS, and cervical spine pathology. This evidence is presented for review by all involved parties, including Gallagher Bassett, True Blue, Pollard Miller, Gail Benson/Gil Benson and Heather D. McGraw, Dr. Bates, and Dr. Baker. This comprehensive document has been meticulously compiled through verbal dictation due to Mr. Starchild's accident-related impairments, which significantly affect his motor skills and ability to accurately type such a detailed and complex legal and medical record himself. 2. Mr. Hawk Starchild's pre-injury status and professional background. Prior to the incident on February 20th, 2025, Mr. Hawk Starchild possessed a verified history of robust physical health and demanding professional capabilities. Comprehensive DOT physicals. For over 10 years, Mr. Starchild consistently passed all federally mandated Department of Transportation DOT physicals. Recent clear physical. Most critically, Mr. Starchild underwent and passed his most recent DOT physical with flying colors in October of 2024 prior to the accident. True Blue possessed a physical copy of this paperwork, also logged in their system since early October. This examination explicitly noted no pre-existing conditions or physical limitations that would contraindicate his ability to perform physically demanding work. Crucially, Mr. Starchild provided this record to all medical places, specifically Concentra, as well as Dr. Bates' office at MBI, both of whom attempted to refuse the record. A copy was also sent to opposing counsel Gail Benson and to the pre-hearing judge at the Division of Workers' Compensation. Extensive rigorous work history with employer. Notably, Mr. Starchild completed 14 verifiable, extremely rigorous contracts specifically for True Blue prior to this accident. His previous contract concluded on January 29th, 2025, and he began the new contract on January 31st, 2025, continuing until the incident on February 20th, 2025. Active professional life. Mr. Starchild is the CEO and main screenwriter, director, and producer for GTF MC Films and Studios, as well as the CEO of GTF Media Corporation. He is a world-renowned author and the main producer/director for Eclipse Nation shows since 2015. His roles require active physical engagement, as evidenced by numerous online videos, e.g. YouTube, where he leads by example, actively moving and performing to train others. No prior limitations. At the time of the accident, Mr. Starchild had a clear physical background, phenomenal physical attributes, and no documented physical limitations. 3. The traumatic incident, mechanism of injury, February 20th, 2025. Mr. Starchild's injuries directly resulted from a severe and dynamic crushing impact, extreme force, object description, and malicious act. He was subjected to a crushing impact when an upright framing mechanism, not a bar or rail, standing 20 feet in length, 3.5 feet wide, and 1/16 of an inch thick, weighing over 800 pounds, was intentionally let go by an employee on the far end who was assisting in laying it down in a malicious act of rebellion. This entire incident, from the release of the object to its impact, occurred within approximately 3 seconds. This immense object struck his right upper extremity 3 times, once in the top shoulder, once in the right bicep, and then descended completely from his right shoulder down to his right palm and hand. Protective maneuver and compounding forces. Crucially, as the object was descending and impacting his right side, Mr. Starchild attempted to pull away sharply to the left. This protective reflex introduced significant torsional, traction, and lateral flexion forces to his cervical neck and upper thoracic back spine, while his right arm was simultaneously enduring direct crushing trauma. This biomechanical dynamic provides a direct explanation for simultaneous damage to both the right upper extremity and the cervical/upper thoracic spine. Scientific principles confirm that such a mechanism will cause interconnected injuries, with the right side potentially appearing less damaged on imaging in certain spinal areas due to compact crushing forces versus the stretching/tearing forces applied to the left side during the pulling motion. IV. Immediate post-injury symptom onset and clinical presentation. Immediately following the accident on February 20th, 2025, Mr. Starchild experienced a profound and persistent array of symptoms, directly indicative of severe nerve and systemic injury. Right upper extremity, weakness, swelling, extreme temperature changes, numbness, and tingling. A distinctive sensation described as razor blades cutting through my fingers when attempting to pick up objects. Hallmark of allodynia/hyperalgesia. Neuropathic/systemic. Dystonia. Involuntary muscle contractions. Allodynia. Pain from non-painful stimuli. Extreme headaches. Vision problems. Lightheadedness. Overheating. General extreme temperature changes. Bradycardia. Slow heart rate. And impaired motor skills. Autonomic storms. Mr. Starchild developed autonomic storms, for which he received no specific care for 4 months post-injury, apart from physical therapy. Diagnosed CRPS. Mr. Starchild has an established diagnosis of complex regional pain syndrome, CRPS, in the right upper extremity, confirmed by a 3-phase bone scan and a pain management physician. Versus objective diagnostic findings and diagnostic limitations, the medical evaluations performed to date have relied on imaging that, while revealing significant pathology, likely do not capture the full extent of Mr. Starchild's injuries due to limitations in the diagnostic protocols and potentially inadequate medical care. Initial arm MRI, March 11, 2025. Without contrast. Mr. Starchild's initial MRI for his right arm, performed on March 11, 2025, under the purview of Dr. Baker, was conducted without contrast. Crucially, it was specifically stated at that time that if Mr. Starchild's conditions worsened, a more comprehensive diagnostic study, specifically a full MRI arthrogram on his full arm, would be necessary. This advanced imaging, designed to better visualize soft tissue, joint structures, and inflammatory processes, was not subsequently performed despite worsening conditions, thereby potentially obscuring the full extent of the arm injury. Cervical spine MRI without contrast. Similarly, the cervical spine MRI, while revealing significant findings detailed below, was also performed without contrast. As a result, the full extent of inflammatory processes, active nerve root damage, or subtle lesions within the spinal cord or surrounding tissues may be significantly underestimated or not fully visualized, thus preventing a complete and accurate understanding of the damage. A. General impressions. Multi-level stenosis, protrusions and osteophytes at C4 to 5, C5 to 6, and C6-7. Linear hyperintensity in the spinal cord at the C6-7 level, consistent with a prominent central canal or a small syrinx. No Chiari malformation, no acute fracture, muscle tear, or ligamentous abnormality, meaning no gross bony breaks or major ligament tears were identified on this specific MRI scan. B. Detailed level-specific findings. Pons, cerebellum, medulla. Foramen magnum, visual portion is normal. C1 to 2. Narrowing of the anterior articulation. Degenerative changes in the joint. Prominent adipose tissue. Incidental finding. C2 to 3. No protrusions or stenosis. C3 to 4. Minimal bulging. No canal or foraminal stenosis. C4 to 5. Central and right central protrusions and osteophytes. Postural and ossified foraminal protrusions. Likely more osteophyte/calcification impacting foramina. A P dimension in the spinal canal measures 10 millimeters, indicative of relative central stenosis. Mild canal and moderate left formal narrowing. Moderate disc space narrowing, C5 to 6. Central protrusion, and left larger than right formal protrusions and osteophytes. A P dimension in the spinal canal measures 9 millimeters, indicative of absolute central stenosis. Moderate canal, severe left, and moderate right foraminal stenosis. Mild disc space narrowing, C6 to 7. Mild canal narrowing. Linear hyperintensity in the spinal cord at the C6-7 level, consistent with a prominent central canal or a small syrinx. This is a critical finding of an abnormality within the spinal cord itself, which can be symptomatic and potentially post-traumatic. Disc spaces. General. No single intensity, suggesting no overt acute inflammatory or infectious processes. Architecture and spinous processes. General. Normal architecture and spinous processes. No fracture. VI. Refutation of medical opinions and questionable practices. Medical reports and documented actions from Dr. Baker and Dr. Bates contain conclusions that are directly contradicted by the objective medical evidence, the established facts of Mr. Starchild's case, and the fundamental principles of injury causation, demonstrating a pattern of misrepresentation and potentially fraudulent activity, systematic neglect, and inadequate scope of examination for entire right arm. Despite Mr. Starchild's consistent and persistent complaints about pain and symptoms extending throughout his entire right arm, all the way down to his hand, since his first visit with Dr. Baker on February 21, 2025, and continuing under Dr. Bates' care, both medical professionals have inexplicably and continuously focused only on the right shoulder. This narrow and incomplete assessment has resulted in the systematic overlooking and inadequate evaluation of the full extent of the injuries to Mr. Starchild's entire right upper extremity, despite his continuous and explicit reports of widespread symptoms. Dr. Baker's sustained misrepresentation, fraudulent paperwork, and deliberate undertreatment. Mr. Starchild notes that Dr. Baker, the initial work comp doctor, engaged in a sustained period of misrepresentation and submission of fraudulent paperwork regarding Mr. Starchild's conditions. This misconduct began on February 21st, 2025, and continued until May of 2025. During this time, Dr. Baker explicitly stated he would not order necessary medical tests because it would incur costs for the insurance company, directly resulting in Mr. Starchild being put into financial hardship. Furthermore, Dr. Baker consistently downplayed the severity and diagnoses of Mr. Starchild's conditions, as stated by other medical professionals. This pattern of conduct reflects a prioritization of insurance company finances over appropriate patient care and an attempt to minimize the severity of Mr. Starchild's accident-related injuries. Dr. Bates' pattern of fraud, misrepresentation, and retaliatory conduct. Dr. Bates has systematically engaged in fraud and misrepresentation of Mr. Starchild's conditions, along with concerning professional conduct. Initial misrepresentation and forced correction, June 16, 2025. Upon Mr. Starchild's first encounter with Dr. Bates on June 16, 2025, Dr. Bates' initial paperwork falsely stated that Mr. Starchild's symptoms began on February 18, 2025, 2 days prior to the actual incident date of February 20, 2025. Dr. Bates was subsequently forced to correct this fabricated onset date. Retaliation and continued deception, June 24, 2025. During Mr. Starchild's second encounter with Dr. Bates on June 24, 2025, Dr. Bates scolded Mr. Starchild for reporting his previous wrongdoings. Despite this, Dr. Bates continued his deceptive practices, verbally lying to Mr. Starchild and subsequently misrepresenting the actual findings of the New Health Images MRI report within his own medical report. Dr. Bates' claim 1. Overall, the degenerative changes in the cervical spine would not explain the ongoing right upper extremity issues, / any of the symptoms in the arm are not related to the neck. Refutation. This claim is demonstrably false. The MRI clearly shows severe left-sided neural foraminal stenosis at C5 to 6, compressing the nerve root that supplies the right arm. Absolute central canal stenosis at C5 to 6, 9 millimeters, and a linear hyperintensity / syrinx within the spinal cord at C6 to 7. These are profound anatomical abnormalities within the cervical spine. They are medically proven causes of weakness, numbness, tingling, pain, and other neurological symptoms in the upper extremities. To state they are non-contributory is medically unsound and dismisses objective findings directly correlated with Mr. Starchild's reported symptoms. Dr. Bates' omission of the syrinx / linear hyperintensity finding further undermines his non-contributory conclusion. Dr. Bates' claim 2. There is no evidence of acute injury to the cervical spine. Refutation. While the MRI did not show an acute fracture or gross ligamentous tear, this statement narrowly interprets acute injury and completely dismisses the immense 800 pounds crushing impact and the biomechanics of Mr. Starchild's defensive pulling motion. This type of severe trauma can directly cause or significantly exacerbate disc protrusions, osteophytes, ligamentous strain leading to stenosis, and even the formation of a post-traumatic syrinx, none of which require a visible fracture to be directly caused by acute trauma. The immediate onset of symptoms after the accident powerfully contradicts the notion of no evidence of acute injury. Dr. Bates' claim 3. Attribution to age. Refutation. This claim is directly disproven by Mr. Starchild's recent DOT physical, October of 2024, which confirmed his excellent physical condition and noted no pre-existing age-related conditions that would explain the severe pathologies or symptoms now present. True Blue possessed this record, and Mr. Starchild provided it to Dr. Bates' office, who attempted to refuse it. Dr. Bates' claim 4. The autonomic storms are not related to the injuries in the neck. Refutation. CRPS is an autonomic-mediated pain syndrome, and it is frequently triggered by nerve injury and trauma. Spinal cord abnormalities like a syrinx and severe nerve root compression can disrupt the autonomic nervous system. Dismissing any connection between cervical spine injuries, which include severe nerve compression, and a spinal cord lesion, and autonomic dysfunction ignores established neuroanatomical and physiological connections. Dr. Bates' claim 5. This has nothing to do with the accident itself or how it happened. Refutation. This is a comprehensive and categorical denial of causality that directly contradicts every piece of evidence presented. The severe 800 pounds crushing impact, the dynamic mechanism of injury, pulling away, the immediate onset of debilitating symptoms, the objective MRI findings of severe and symptomatic spinal pathology, and a clean pre-injury DOT physical. This conclusion is unsupported by the factual and medical evidence. Dr. Bates' selective reporting and omissions. Dr. Bates' report demonstrates selective reporting by primarily focusing only on the C5-6 level in his discussion of findings, and omitting any mention of the significant linear hyperintensity / syrinx at C6-7 and other levels of narrowing. This omission distorts the full picture of the cervical spine pathology and biases his non-contributory conclusion. Dr. Bates' redundant recommendations. Dr. Bates's recommendation for a CRPS evaluation and additional autonomic testing to Dr. Tashoff Benson, MD, appears redundant, given Mr. Starchild's already established CRPS diagnosis, confirmed by a 3-phase bone scan and a pain management physician. 7. Conclusion and call to action. The objective medical evidence, including the detailed MRI findings, Mr. Starchild's documented robust pre-injury health and employment history, including 14 rigorous